Okay, so how you doing, guys? So we have Zlata over here. So she's complaining about right elbow pain on the outside, neck pain when she looks downwards, okay? Some pain in the mid-back over here, and also low back pain, with addition to some numbness. Show that right foot of yours. Okay. So point to me, where are you having that? So numbness right at that spot right over there, okay? In addition to, okay, she also shares with us she's been trying to get pregnant and she has a lot of difficulty doing so. So we're going to take a look, see what's going on, find out where all these potential problems are. So first we're going to start off with instrumentation. We're going to look for, is there any heat difference going on? Yeah, there's a small little reading over there. Yeah, there it is. At that level, there it is. So we're at the second dorsal level. And I believe we saw something around the mid-dorsal as well. Yep, it's very, very subtle. So it looks like this is a possible chronic nerve, so we're going to take a look. Yep, it's right there. Right at that level. We'll check for is there any swelling or edema or muscle tightness. So we can tell this spot right over here is swollen. Trace it down. We got one right here at this level here too. This was more chronic, so that's why the swelling is not as evident. So we're going to mark it that level right there. Because we see all the puffiness surrounding it, and yet it sinks in right at this level right over here. So now what we're going to do is we're going to do motion palpation, and we're going to check for normal, okay, all the structures should move freely. Abnormal is going to be stuck in a particular direction. So first thing first, we're going to check how is the foundation? Okay. How is this pelvis? Okay. The left hip is moving freely, left and right, back and forth without a problem. Okay. Now we're going to check the sacrum itself. Okay. Seems to be stuck. Doesn't seem to be moving too well in this direction. Feel how much it moves on the right side?
Better.
Better, right?
Mm-hmm.
Feel how much it doesn't move too much on the left side?
Doesn't move too much.
Right?
Mm-hmm.
So, since this foundation bone is not moving too well, on top of that we see the swelling, okay, all over here, okay? It should be nice and smooth from here, progression, but nope, bump, bump, and even more swelling, pooling on the bottom. So, we got some problems, and all already indication that this is a potential problem. We've got to take a closer look on the x-ray itself, okay? So, we can feel right now, all these bones, very, very stiff, okay? Now this should be normal, it should have motion in there, but because the foundation is compromised, you lost a lot of that springing action. Just like a shock absorber, it should be springing, okay? Okay, just we figured, it's stuck right here, not moving too well. Yeah, right? Yeah, right there, number 2. See, what we're going to do is we're going to check her elbow, okay? So she's complaining about a lot of pain. Go ahead, point to me. Where do you feel that pain? Okay. And we can see there's quite a bit of, yeah, it looks like almost like a bruise, okay, right over here, okay. So, what we're going to do is we're going to do a nice stress test over here, okay. So normal, okay, if it's stable, should not have any extra give to it. Abnormal, there's going to be some little give to it, okay. So when we test it, nice and stable, on the outside over here, that is, okay? No problems. When we challenge it on this side, there's quite a bit of give, okay? And you can also feel it. Duplicates the pain a little bit.
Yes, pain.
Okay. Other thing, we also check the wrist. Okay. See how it moves. It does move up and down without a problem. Ulnar bone, we check. Moves up and down without a problem. We're checking the scaphoid. Okay. We're checking the wrist bones. Okay, not a problem. Go ahead. Shake my hand. Squeeze really hard. No, squeeze hard.
It's painful.
I understand that. Squeeze hard. Okay, squeeze hard. Squeeze hard. Good. So we're to confirm, right now the problem is definitely here. So what you have right here, okay, this is a posterior lateral ulnar misalignment over here. Okay. So what we're going to do is we're going to set this bone right back in its place. Okay. But before we do that, okay, we need to clear this. Okay. Because you have a structural abnormality right here, the second dorsal. Okay. In essence, what happened was, it's just like a traffic jam over here. It reduced the nerve flow to this elbow. This also helps explain why you're explaining about numbness and tingling on these two fingers over here. Okay, so we're going to correct this over here, alleviate the tension over here, free some more nerves, get it flowing to this elbow and to these final two fingers over here. Okay, so we have to correct this first before we set this. Okay. In this X-ray structural analysis, there is one major structural abnormality that causes a domino effect for the entire spine, and that is the sacrum itself. Okay, so normal, I want to see the sacral angle at this point over here. Instead, we see the sacrum knocked backwards a bit in this angle. In addition to the sacrum over here, I want to see it in this normal position. However, it rotated quite a bit towards the right, and every single structure above it also rotated towards the right, all the way to the very top of the skull. Now, in the Gonstead system, all these rotations you see over here is what we call compensations. Now, if it's left uncorrected for a prolonged period of time of the major one that started all off, eventually some of these compensations may turn into a structural abnormality. As in other words, we also call it compensations that turn into subluxations. So yes, although we do need to correct her second dorsal and the sixth dorsal to help alleviate her neck pain and her elbow problems, in addition to the ring finger and the pinky finger, none of that will stay corrected and stable until we correct the one major problem that caused the entire domino effect, the sacrum. I'll just say a quick prayer, that's all. Lord, give us wisdom.
Yeah.
Give part of your infinite wisdom. Okay. Knowledge, peace, and love. Okay.
Yes.
Give your blessings. Allow this healing to happen. Okay. Right there, just watch the shoulder right here. Just a little more.
Oh! It's okay. Oh! Бля. Ой! Wow. Круто. I like it.
Okay, next thing I want you to do is look down. Any pain with that? How do you like that?
Ding, ding, ding.
Okay, so now, okay. Go ahead, let's take a look at your elbow.
Oh yeah, this is, oh my goodness.
So, already, how is this? No, how's it right now? The pain level?
Better.
Better, right? Part of the time. We didn't even adjust your elbow yet. Right? So, but you still have some, see that? This elbow is still misaligned. Okay?
Пока, да, пока. Я не знаю. I don't know.
Okay. Just let it go. Just relax. So we just gotta set this all up.
Ой, мамочка.
Move your elbow around, see how you like it now.
Фуh.
How's it?
Pain here because it's not.
No, I understand that. How's this?
This is definitely better. Definitely. But pain here.
Okay.
But this is okay, I think.
That's okay. That's okay. Now, how's these two fingers over here? No?
This?
Yeah.
Good.
Is it numbing? Is there any
No.
numbness there?
No, no.
Gone now? You got feel?
Mm-hmm. Better.
Yeah.
Mm-hmm.
You like it?
Yeah, I like it. This
Okay.
is.
Squeeze my hand. Tight. Good. Tight.
Mm,
Tight.
Better.
Much better, right?
Better.
No pain.
Pain when I do like this. Pain, but not so bad.
Okay. This, right now, okay, all the muscles here,
Mhm.
okay, because we corrected this, okay, is trying to readapt what's going on
Readapt.
over here, okay?
Mhm.
Give it some time. It takes
Okay.
about 2 to 3 days for the muscle spasm to calm down,
Mm-hmm.
right? Everything else looks good. A little reading there. Much better from the previous. All right, Zlata.
Mm-hmm.
Are you loving it?
I like it.
Yeah. Tell it to me.
Everything is perfect. I love it. Thank you so much, doctor.
Thank you.
Thank you.